I'm Celeste, and this is Celestial Navigation. As a transgender woman, I wanted to help you understand who trans people are and how you can support us. This is the next part of an ongoing series reviewing Dr. Preston Sprinkle's interview with Dr. Paul Eddy about detransition, and I'm happy to have my friend Billie Hoard join me again. With that, we begin with Dr. Preston Sprinkle.
There was thorough analysis. People have gone through counseling, psychotherapy, like they've exhausted all other ways to maybe reduce, manage, mitigate gender dysphoria. Nothing's really.
I just want to be really clear there. Psychotherapy is not a way to reduce gender dysphoria. Sprinkle is there talking about something that doesn't exist. There is no study, there is no evidence-backed method of psychotherapy that reduces gender dysphoria safely, long-term, etc. So him saying exhausting all other options is like, that's not an option.
Can I jump in actually on what he is thinking as far as I can reconstruct here? So one is he has very clearly on multiple occasions said that he has not given up on conversion therapy for transness. And this is important because he has given up on conversion therapy for gayness. That's kind of what sets him into that, why he hangs out with the side B gay Christians, right? Because he's given up on conversion therapy as an option. And he did that on the basis of a lot of work by Mark Yarhouse. And this is where it gets really interesting to me, because Yarhouse is theologically not affirming, but he's also, I will often say, he's a pretty honest scientist, right? He's a psychological researcher and he's honest with what he comes up with. And so he's also clear that dysphoria doesn't go away. If you try to pin him down, he's like, well, at least post-puberty, it doesn't. And so Yarhouse takes the approach of what he calls managing it. So people have different levels of dysphoria. And so he says, sort of based on your theological conviction, you should not transition unless you absolutely have to. The dysphoria is just too bad. So I think what Preston is trying to get at here is not actually ways to what we would call treat dysphoria. That is to say, stop experiencing dysphoria, right? He's getting at can you find methods to live with the suffering of dysphoria to where you can say you still have some kind of quality of life? And some people can to some extent and some people can't. And it's worse. I lived until I was 30 something with pretty active, somewhat low grade. I would spike and it would decrease dysphoria in the background. My egg cracked, my dysphoria spiked, it got really, really bad. And I got to the point of being, kind of non-functional minus transition. So, and it kind of frustrates me, honestly, to say that Yarhouse would probably have said it's okay for me to transition because of how miserable I was right before I transitioned. And I really dislike the idea that you have to suffer to some legitimizing extent for transition to be okay for you. But I think that's what Sprinkle is actually trying. I think if you really pin him down, and this is kind of based on what I've read of him and what I've heard him say in the past and his interactions with Yarhouse, I think it would kind of come down to Sprinkle, I think, does believe that in some cases dysphoria will go all the way away with the right therapy. And I think Yarhouse would disagree with him on that one. But he would also say that for a lot of cases, dysphoria can be kind of managed to where it doesn't interfere with your quality of life so much that it would justify transition. And Yarhouse does a whole thing where he sort of says well, maybe you can figure out minimal ways to you can transition in secret. And so I think that's what Sprinkle's drawing on here. And I find it all very disturbing. But yeah, I think that's what he's drawing on.
And the way I have heard Yarhouse cited is, this view of you can transition as far as you need to save your life. And that's fine, but that's about as far as you can go.
Yeah.
And I don't know, even just as a Christian, when Jesus says, I came that you would have life and have it abundantly. Right? I don't think that's what he had in mind, right? No. When Jesus says, my yoke is easy, my burden is light. I don't think he had in mind a lifetime of debilitating but not deadly gender dysphoria. Looking at Jesus of the Gospels, I don't understand where you landed a view that Jesus wants his followers to live in a state of perpetual dysphoria and all the things that go with that and all of the ways that is really harmful to yourself and others.
It's very much rooted in this transmedicalist idea that transition is unfortunate but is justified by the severity of the suffering, which is kind of the approach, if I remember correctly, that Preston Sprinkle's two trans friends take, right? The two friends he has that have transitioned, they take a kind of I don't know how God feels about it, but I do know that this was necessary for my mental health. And Sprinkle's like, well, we should be kind to them about that. Like, we shouldn't be. And I'm glad he's being nice to people, but it's not affirmation, right? It's pretty heinous.
I struggle with the definition of kindness. For Sprinkle, I tend to use the word polite, not kind. Because kindness means listening, kindness means supporting, kindness means actually wrestling with that. And it's hard for me to see him as kind when he so consistently does things like we're walking through right now. Right?
Yeah. No, I think that's totally fair.
Yeah. Polite, sure.
Yeah.
Would I rather have lunch with him than Matt Walsh? Absolutely. And I would have lunch with Preston Sprinkle.
Mm-hmm.
I wouldn't with Matt Walsh. There's no point. So, right.
Working and transitioning is kind of a last ditch effort to relieve someone's dysphoria. If all that is, do the studies show that if those steps are taken, that there is a very, very high satisfaction rate? Would you say the studies at least bear that out?
Yeah, that's where I think you get the statistic that I suspect is accurate. Even though we have all these other problems methodologically, I suspect that if you do all that, you're probably in the ballpark of 90% satisfaction rate if those protocols are followed. Even the study.
Where did he get 90%? He was just talking about 2 and like 0.2 and 0.3%, 0.3 and 0.6%. And now he's got 90%. Where did again, this is like, if we have a title for the series, it's just like two doctors pulling shit out of their ass. Like, oh my gosh.
Right? It was wild that he's like, I think those numbers are probably correct.
Right.
And then immediately replaces them with a different number.
Right. And that was the thing. He's like, if all of the protocols from the 60s and 70s for gatekeeping are followed, which is why he said the numbers were so low in this one study that he otherwise had said was a very good study. Right. So he's like, if in that situation, I think, and then he jumps from 0.3 to 0.6 all the way to 10%. Like, what is happening?
Right. It's just so inconsistent. And again, his whole he's immune to bias. Come on. Gosh.
Jesus magic protect his numbers. Where does he get it? Where? For me, again, the ongoing question is just, does he know he's doing it? I don't know. I don't know if they know they're doing this or not.
Yeah, I don't know. I would say I don't know if they know they're doing it. When we publish this, it'll be interesting to see if either of them respond and say, yeah, you're absolutely right. We are doing that when we do this. And we're sorry for doing that. And we are going to actually unpublish the paper. We're going to unpublish this podcast. And we're going to go back, do some rigor. We'd love to work with both Billy and Celeste on this if they're willing. But regardless, if they did that, that to me would be a show of integrity, right? That they would say, wow, there really are so many problems with this have been brought up that, this is not the methodological rigor that we set out to have. Right? If we want to be known for rigorous analysis, we got to do better than this. Right? And so I will say, I don't know if they mean to do it and that they're just intentionally dishonest. I think it's pretty clear that they're reckless with it, right? That they don't take the steps to be careful. And we talked about that last time.
Reckless is a great word.
Right. They're all 7.9 in one, 8 in another. I think the highest regret detransition rate that I've ever seen came out of a study by Green and Fossum, I think it was a 1990 study. And they found that for female to male, in their study, the detransition or regret rate was 3%, but the male to female was 13.1%. That's the highest.
Remember that when we get to ROGD and they're going to talk about all these female to male transitioners detransition, they're going to detransition because social contagion. Remember, he just said the lower one is the female to male. The study that had the highest detransition rate he's ever seen at 3% amongst female to male and 13 amongst male to female. Right? Still low.
Yep.
Still phenomenally good.
That I've ever seen. Now, again, that's 1990. So they're working off 60s, 70s, 80s, really strict protocol data. I think we got to realize that Roberts et al., this is a group that just published a study 2 years ago, 2022.
Oh, wow.
Now, what they were studying is not surgical transition, but hormonal transition.
Okay.
And they found that 30% of people who transitioned hormonally, began cross-section, had stopped doing that within 4 years.
Oh, wow.
30%. So once you start saying it's not just surgery, it also can be hormonal, then we have work. and very few studies have ever tracked Roberts. I can't think of another one, honestly. And they found 1/3 of the people desist or don't persist in their hormonal therapy after 4 years. So,
many studies cover a broad definition of detransition, right? And transition satisfaction and regret. And many, many, many trans people do hormones only for their transition, that they never do surgeries, and he's about to talk about them. But I actually went and looked at that study before we got on the call. I saw Evan Urquhart from Side Media talked about it. He said, yes, it is a well-designed study. It does show 30%. He agreed with that number on it. But he said there were issues with it. It was just people who had had a prescription for HRT. So it was in the U.S. military context, which I question whether that's generalizable to a population. But within the U.S. military, they said 30% no longer had their HRT prescription that they got through the U.S. military. And so did they go get it private, or, get it from different health insurance or something? They said they did account for it if they just left U.S. military health insurance. Those were not included in the study. But yes, it puts that out there. What's also not included in that number that he said was how long did they do HRT before they desisted? And Evan does point out, this is desistance, not detransition, because we don't actually know that the people stopped who actually did detransition. We just know that they maybe didn't do hormone therapy. One of the things that I think is pretty well known in the trans community, to some extent, you're going to find out pretty quick whether or not HRT is right for you. That's not to say whether or not you're trans, because you do not have to be on HRT to be trans, but you're going to find out pretty quick whether HRT is right for me. For me, within a month or two of taking HRT, I was would do crime to keep my access to estrogen and Spiro, right? I'm we'll never go back ever, because it was so life-changing for me. Just the mental effects of it. And so many trans people talk about that. And I hear so many cis people just miss that. But it's for whatever reason, and I don't know how it works, but for whatever reason, my brain runs much better without a bunch of testosterone and with estrogen. It's so much easier for me to live my life. And I'm so much happier with that. So we don't know whether these are whether the 30% rate is maybe just the number of people who try HRT, and then 2 months in, a month or two in, they're whoa, this did not go well for me, right? And then they stop. So there's just a lot of question marks.
I think, there. I was thinking of some other question marks, and it may have been actually Evan that was pointing this out. But there are a lot of non-binary people, especially who will do HRT for a period of time, and then be "That's actually the results I wanted," and then stop it because that's good for them. And if they're showing up as desisters, I mean, that's only it's misleadingly true, right? They are, and they are not desisting. So you've got that category of people. I mean, there are trans men who, after a period of time, go off of T again because they've sort of achieved what they wanted. Maybe the goal was a beard, and so that they can grow a great beard now.
And drop the voice, right?
Exactly, and that doesn't go back after you go off T. So they're comfortable with it. Again, it's kind of misleadingly true to use HRT as a straightforward thing. The other thing is, and you kind of brought this up, is that it's actually pretty standard practice in the trans community when somebody's trying to figure out what's right for them. Do they want to transition? Are they trans? All this stuff is you can say, look, you can go on hormones. They're pretty reversible for the first several months. So use that to find out. On that level, we would all celebrate a desistance rate. Because that's the whole point, right? We're saying if you get on hormones, you're no, this is not right for me. We're that's awesome. We're really glad you figured that out. That was kind of the goal here. This is a way of figuring out if this is right for you, if this is the direction you want to go with your life.
Right.
And then the other thing is I was looking at, we gotta, at some point, I wish that the Sprinkle and Eddy would look at the US trans survey, even the highlights of the 22 survey. And it's 98% are happy of people on HRT are happy on the basis of that survey, right? It's incredibly high. And I mean, sure, because of the way that the sampling was done on this one, you can criticize it, but that's a lot of people. It's a giant sample size.
Right.
That's all. That is a whole lot of trans people saying you know what, I'm quite happy with HRT. Yeah, that's the one.
So yeah, so this is the U.S. Transgender Survey, and it's 92,000. It is the largest survey study ever done on trans satisfaction and things like that. Life satisfaction since transitioning gender, right? 79% a lot more satisfied, 15% a little more satisfied. That's 94. Okay, but 3% are they're fine with it, right? Like neither more or less. And then you get 1 to 2%, 1 and 2, who say that they are less satisfied with life since transitioning. That's not the same as them saying that they regret it, but it probably forms an upper bound on regret, right?
Yeah.
It'd be surprising if somebody said, I'm a little more satisfied with life since transition, but I regret doing it. It's frustrating to know that I think, based on what we've heard so far, that Sprinkle and Eddy's immediate response to it would be convenience sampling.
It's trans people. Like this, yes, and it's trans people. Like the whole point of the survey was to get trans people to answer, and they're straightforward on the methodology and they're straightforward on the population.
Right, but they're going to be like, yeah, but detransitioners might not have taken it. It's like, well, then do that study. Great.
Yeah.
Show that that's true. Life satisfaction with receiving hormone treatment, right?
That's the one I was thinking of, yeah.
84 and 14, that's 98. 1 more percent was fine. Less than 1%, a little or a lot less satisfied. Yeah. So this one does get you, and he's going to say it, but then he's going to draw a wrong conclusion from it. He's going to say the farther you go, lower the detransition and regret rates get. Because, it's kind of the more committed, you've had more time to think about it and things like that, which I think makes a lot of sense, right? If you count detransitioners as anyone who literally ever tried wearing clothes more typical of the opposite gender to see how it felt, right? And then if they were like, yeah, and I never did that again, if that counts as a detransitioner, then the number's a lot higher.
Right.
But that's not what we mean when we say detransition. Saying something out is not what we're going for here. What we mean when we say detransition, and what the whole risk of it is, allegedly, is you're letting people make medical changes, and if they regret them, they're hard to undo. And that is a valid concern, but it appears to be a life satisfaction after gender affirming surgery, a lot more satisfied, a little more satisfied, right? 97% combined, another 1 apathetic, and at most 2% no. And that makes sense to me. That there'd be a couple percent, because you can have surgeries that don't go well. Surgery is always a risk. I will say, as someone who just went through facial feminization surgery 3 months ago, I'm still recovering. I've still got swelling in my jaw and things like that. I cannot believe the difference that it has made in my life already. It's unbelievable how much of a difference it's made in my mental health. The gender dysphoria around my face, which was severe and crippling at times, right, is 95% reduced, right? I love looking at myself in the mirror now.
Oh my gosh.
And I'm far more satisfied than I thought I even could be, right? Again, it's I found this new level of happiness that I didn't know existed in life. Man, it's phenomenal.
My gosh.
So, and in a way that, if Preston Sprinkle went and got the same surgery that I just got, I imagine he'd be pretty upset about it.
He probably wouldn't be thrilled. Yeah, no, I can't imagine he'd be thrilled.
This isn't a surgery like going and feminizing your face. This is not something that I imagine a lot of cis guys would be super excited about. Many trans women don't even want to do it. And so, which is fine. Everybody gets to make their own choices. And that's how this should be.
Hey there. If you're enjoying this episode, can you make sure to like the video and subscribe to the channel? And feel free to leave a comment with feedback, your own observations, or a question. Okay, let's get back to it.
I think that with what's happened in terms of the explosion of gender dysphoria, the move to a strongly affirmative view,
there's not an explosion in gender dysphoria. There's an explosion in people getting treated for it. And also define explosion, please.
We're in such new territory that the longitudinal studies we need to understand what we're doing now will not be able to happen until 10 years out from when. Let us take the break point of 2015. Time Magazine said that was the transgender tipping point year. That means only next year could we start to get 10-year data on people that transitioned in 2015 and then keep that going to know what's really going on in this kind of new world we're living in?
There it is.
So, yeah, there he goes. He's like, basically like, we can't know. By the way, transgender tipping point was 2014, not 2015. So actually, we just hit the 10-year anniversary of it.
The changes in healthcare for trans-identified people. Like, because you referenced, like, in the past, they go through thorough psychological evaluation, and you're kind of, hinting at that that's not the case anymore. Can you maybe expand on that? When did that?
Just real quick, I will add a link to Abigail Thorne's video on trans healthcare in the UK. Like, by thorough, they mean humiliating. That there is a reason why the trans community didn't want to do that.
That shift happened. Why did it happen? Why is there no less, if any, psychological evaluation before people are, to transition?
Yep.
I'm going to throw a flag on suggested to transition.
Yeah.
I don't know about you, but my experience is I have never once had a medical professional suggest a transition thing. Like, I go and ask, I say, I want to do this. They make sure that I'm in good shape to do it, that I understand what I'm doing. They do have to check mental health. They have to check in with my therapist. Are there contraindications that say that Celeste shouldn't be allowed to move forward with this yet? So there is still some gatekeeping in those things, except for HRT. But like that whole like suggested that they transition is not a thing. That has to come from the trans person.
Yep. Yeah. If anybody's suggesting to a trans person that they transition, it's like community. Like, they might find people online who'd be like, yeah, you should transition, it'll be better. But like, not medical providers. That, like, my therapist was ridiculously careful to not ever let me feel pressured to make that decision. And that was like the bulk of my therapy for the first several months. And her whole thing was like, that has to be your decision. Like, I'm not going to pressure you into making that. And I went to the doctor and they were like, hey, what are you here for? And I said, I'm a trans woman. I would like to go on hormone replacement therapy. And it was at that point, they're like, okay, we can do that. Here is, and then they rolled out informed consent for me. And like, we actually had to spend all this time and here's what it's going to do. And here are the side effects. And at no point did any medical person suggest or pressure or push towards anything like that. They're playing fast and loose. I think what we're actually seeing is like what they believe bleed through from behind that facade of Jesus magic impartiality.
Yeah, absolutely. I did ask on Reddit once, like, when I was considering HRT, I was like, okay, so is there any reason I shouldn't just start this and give it a shot? Right. And on Reddit of all places, like a trans subreddit, like, which is like among the most pro-trans places, the resounding answer was like, yeah, these are toys. Nobody was willing to be like, yes, you should try HRT. They were all just like, make sure you know what you're doing.
Forever, the standard stock wisdom among trans people was you shall not tell somebody that you really think is trans that they are trans. They have to work it out for themselves. Like, and so again, they're coming from a place of being a person who knows two trans people. He has an incredibly biased and limited sample that he is allowing to inform him. And that he is treating as representative of like the trans community as a whole in ways that they simply aren't.
And I don't want to suggest that there's like a night and day thing. This has been a slow evolution, but really what the impetus behind this shift is that the trans community has said that what happened to them is that the medical establishment has basically pathologized their condition. It's an illness, it's a mental health issue.
No, it's not an illness. Like, that community had defined it that way.
Diagnosable condition. And so they are the gatekeepers. The medical establishment gets to decide. And the trans community has been pushing back on that, saying, wait a minute, we're the ones who know. And I think what's really going on here is this is part of a larger cultural phenomena, Preston, that where we're seeing personal identity as measured by people's subjective sense of self is becoming the fundamental authority in the Western world today. It's not just trans.
So, okay, just short flag. Let's just flag the fact that he said what I think is going on here is cultural phenomena, and he is now nowhere near any of the research he did. It was a straight up, and now I'm gonna pull something out of my ass to explain what I think I just said.
Right. Yeah, and this rhymes with Carl Trueman's Rise and Triumph of the Modern Self. He jumps to this, the West says the self is the primary authority. And of course, as Christians, we know that's wrong. Jesus is the primary authority. It's like, But what we're talking about is somebody's internal lived experience, right? Their internal mental state and things like that. And it's like, what else do you have to go on? Like in this particular one, like, and we do this with depression or anxiety. We ask people, how are you feeling? Like you go through the PHQ-9, you take all the depression questions and everything like that. The standard of care is you trust the patient to tell you what's going on. And if they answer particular answers, then you're like, well, that's depression. So let's talk about what to do about that. Hey, but there's
there
no
are
external
realities
to do.
Right. There just are realities that are only experienced by each subject, like by the person. And the medical establishment has to choose, like they come up with their tests, they come up with their approaches. But at the end of the day, the only person who can talk about how I feel is me. Like you can't tell me, no, Billy, you're not hurting right now. Like, I'm right here. I'm hurting right now. Right.
And like the only other option to what they're saying is people outside of you get to tell you what your internal experience is. Like that's the only other option, which of course, that's why they index on the body. And I frequently have said, like, everybody agrees that people with gender dysphoria should transition. It's just people like Sprinkle think that they should transition their mind. We think we should transition our body. And mostly we think that we should transition our body because for a lot of us, we already tried transitioning our mind and it didn't work. And nobody's found a good way to do that. And also, I feel like my mind is a more personal thing. Like it's more me than my body is. Both are me, and I'm not doing a Gnosticism here, right? But like for me, changing elements of my body is a less significant change than changing my mind. Like my mind is my personality. When people think of me, they tend to describe how I interact with people. They tend to describe more mind things than, well, she's 6'2", right?
Yep.
So this is just part of that locomotive that's running with increasing speed through Western culture. And once you grant that first person experience authority is the fundamental authority in our lives for who we are, then it only makes sense that it's not some guy giving me an assessment, but my own sense of self that should be at the helm of the decisions I get to make in my body. And that's why there's an increasing pressure for pushing back on the medical establishment and saying, no, informed consent should be the rule. In other words, just like most medical procedures, you tell me my odds, you tell me the pros and cons, and you let me decide. Now, the standards of care that are produced updated every few years by the WPATH, World Professional Association.
So we just talked about just like most medical procedures, informed consent. You tell me the odds and I make the decision. What he didn't do was go in and say why that's invalid for us. Like, why is that?
Other than it's very individualistic, and we don't have an external check to get measure. We can't do a blood test to determine your degree of dysphoria.
Right. Which again, many medical conditions, you can't do that anyway. And then the second, one is I have done a gender dysphoria diagnosis. I've done it twice and I'm about to do it again. Right. Like I have been assessed for that. So.
For transgender healthcare has been one of the barometers for this. And up till recently, they suggested, it was always just suggestions, but it was suggested that every person transitioning have at least 2 recommendations from mental health experts. That's been being undercut recently. In fact, SOC 8 just came out recently. I forget I know there's a lot of debate about what should happen there. Do you remember whether that got dropped to?
I didn't follow that, no.
Yeah, I know there was pressure to maybe drop it to 1 or maybe pull the whole recommendation necessary step out at all. I forget what happened there just last year. But that pressure, and even since these are suggestions, actual caregivers don't have to follow that. And I know, I've seen a number of studies where people are saying, we just feel as affirmative clinicians that our job is not to get in the way of people's sense of what they need, but to support their own sense of self. And so, there's Joanne.
Which, I mean, those are people who actually have degrees in this stuff and medical background and are working with trans people all the time. If Dr. Eddy is quoting them correctly, maybe Dr. Eddy should listen to them and be like, interesting, that's surprising to me that you would say that. Can you tell me more about why you came to that conclusion?
Yeah.
Since you have more experience in this than I do.
But hearsay, why not? Why do that when you can always go with some hearsay? Right. And again, I think we said this earlier on, insurance is keeping it at 2, regardless of what the law says, practitioners are allowed to do, how many letters and from whom they're required to. Insurance still requires a letter from your GP, your general practitioner, and a letter from your therapist. And they were talking about like everybody. They've been doing this very like everybody thing. Not kids.
Yeah.
Kids don't have access to informed consent for HRT.
Right.
They don't.
Yes. Absolutely.
They don't at all. It's parental consent because it's medical treatment for a minor. Right?
There are states where at a certain age the kid can go get HRT without parental consent, but it's not like 12-year-olds getting on like puberty blockers or whatever.
Kennedy down in San Francisco in the main clinic saying that she supports double mastectomies for minor age because of the consent principle. And I saw her in a discussion once where someone pushed back and said,
he misgendered a bunch of trans men who went double mastectomies and went top surgery. Just correcting. Yeah. And that's definitely not what Joanna Kennedy says. Joanna Kennedy does not say she supports mastectomies for young women. She supports top surgery for young men who have grown breasts and don't want them. Right. Which is a very different thing to do.
Right. And there was a new study out a week or two ago that showed of the like 150 double mastectomies that had been done for gender affirming reasons in a given year, like all but 5 of them were for people assigned male at birth. So there were like 5 that were actually like trans boys.
Yeah, no, it's incredibly uncommon.
Right. And that's in a swath of U.S. healthcare. It doesn't cover everybody, but it is a giant piece of it that makes you know that the real number isn't thousands. It's tens per year.
Tens.
Yep. Right.
What if my 15-year-old daughter plays the informed consent thing and wants a double mastectomy at 15? And what if she decides she was wrong at 22? And Kennedy said, well, we can handle that we have reconstructive surgery now.
She can go get, if she wants her breast back, she can go get them. I saw the video. It was she literally said they can go get them, their breasts, as if a breast is like an appendage or something, like it's a human organ. It's not, you can't actually go get them. But
that's super invalidating to women who have had to get double mastectomies for medical reasons, cancer, whatever, for Sprinkle to be like almost laughing as he's like, reconstructive surgery, that's not breast. That's something else. I understand what he's saying in terms of function. Yes, reconstruction is not going to be able to make that person probably be able to nurse. There are lots and lots of cis women that can't nurse anyway for a variety of reasons. Like that's not a typical thing to happen, right? Is it regrettable? Like, would it be better if they could completely reverse it? Absolutely. But again, the point here is regret rates. Like if we're talking 99% of people who do this, 99% of 5 who do this are happy that they did this and 1% regret it. It's like a trans boy having breasts in high school.
One of the things
on top of the gender dysphoria, that's just going to be socially difficult. That's going to be all kinds of things, right? Like that's not an easy thing to go through, right?
No, it's also medically dangerous. And this is the part that they're not bringing up, right? Because binding, especially if you have large breasts, binding for a long extended periods of time is really unhealthy. Like, and there's lots of good support for trans guys out there for like how to do it for like appropriate periods of time and take a break. And I'm not saying like don't bind.
It's like max of like 8 hours. It's like I think I've seen like 8.
Binder, don't use an ace bandage or whatever, right? Like be careful and please look. Just if you're a trans guy and you're looking at binding, I totally support you. And also please go find a healthy, reputable medical source that will tell you how to do it in as healthy a way as possible.
Yes, absolutely.
And a lot of young trans guys don't know about that. And as they grow larger and larger breasts, especially if they are larger chested, they will often bind in ways that damage them in the long run. And so like, again, what Sprinkle and Eddy are not taking into account here is the medical damage that comes as a result of refusing to perform top surgery when it is actually a really extreme need.
That's it for this episode. We've still got a lot to cover, so come back next time. You'll find Billie's socials and my own, as well as related resources in the show notes. Thank you for listening.